Talk with us about all these things going on. This term optimal aging. All right, now let's talk about this because we're going to hear this phrase a lot. What is optimal aging in relation to body shapes?
You know, optimal aging is a pretty amazing concept. Really, nobody around is talking that much about it or trying to achieve it, but it can be achieved. It means getting your body back to the place that it was when you were younger. Now, everybody when they were younger felt pretty good, pretty healthy, and so part of that is having the right balance of hormones. And when you were 25, everything was kicking and doing great. Our incentive to do this is that there was a lot of prevention there as well. So what we know about restoring hormones is that we prevent the bad things that aging brings. And a lot of that is through inflammation. So as the body gets more toxic and you just live in this world, you get a lot of inflammation in your system. And so what hormones do for you is it brings that inflammation down. So therefore, your insulin continues to work well, and hey, you don't get diabetes. Your immune system is there, and it can snuff out any cancerous cells that might begin. So getting the immune system, getting the inflammation down, that's what we're really going for, and we know that hormones do that. So optimal aging is keeping yourself clean and healthy as you age, and to think about doing that as you get older is amazing. I mean, that's a really cool concept.
And you come from what you would call more traditional medical background. You came over here to Body Shapes Medical because you were seeing these results in people that the traditional route was not able to help with.
Well, right. As a doctor of what you call the traditional medicine, my job was to try to make people healthier, but I spent all of my time putting out fires. I mean, whatever their symptoms were, I was kind of band-aiding symptoms. And we saw like these biomedical markers that we're checking now, whether that's weight or BMI, CRPs, inflammation, all of this stuff. I knew people had bad numbers on that, but I couldn't do anything about it. But to come over here and to see these numbers plummet, people lose weight, their blood pressures are better. I mean, these are the things we're really focusing on. Yeah, we want to make your symptoms better, and the levels that we aim for are optimal, and so, oh, by the way, all these symptoms get a lot better. But we're aiming for these levels because we want you to be the healthiest you can be. And there's plenty of data that shows if we can get you to these numbers, these optimal levels, that you're just going to be healthy.
Two questions. How quickly do sometimes of these effects set in with some people? I know it's different for every person, but what is the biggest thing, the difference that they see right away, or the first change, I guess, the person would see right away?
Well, it's pretty, I mean, getting people to optimal levels is easy. We know how to do it. There's lots of good medication, and the hormones get you there. So within a month, when patients come back, they are 75%, 80% optimized. And what happens first is the symptom management. So everybody feels better, their energy is better, they sleep better, all those positive symptoms. The other stuff takes a while because we're working inside the body. So we usually will check some of these markers at about 3 months and see some improvement. 6 months we see improvement. But you know, the symptom management, of course, comes first.
Talking with Dr. Bates over here at Body Shapes Medical. In the last minute here, the number one question you get from people when they say, "I'm thinking about this, but why? You know, why should I do this? What pushes them over the edge?"
You know, so many people do come for the symptoms, but once they sit down and talk to me and they realize I can live longer and be healthier for my family, that's the stuff that really sells them, and they're like, "Okay, sign me up."
You going down to the Elm Center this week?
No.
Oh, really?
No.
Oh,
so
man.
Although I have my Final Four tickets.
Okay, you're optimistic, huh?
I'm there, baby. Yeah. I'm in the 8th row in the mid-court. So.
8th row, mid-court, Final Four?
I know. My sister helped me.
That is optimal seating right there is what that is.
Hey, this is what I do, baby. It's all about the big blue.
Dr. Bates, thanks so much.
Thanks for having me.
All right, there you go.